Hello. Welcome again to edenagricare Solution. Today we are going to discuss about infectious coryza, a bacterial disease in poultry. Welcome. Infectious coryza is a bacterial disease that is caused by Avibacterium paragranum, and it is a gram-negative bacteria. It is a respiratory disease that affects the chicken. It is mostly characterized by decreased activity, nasal discharge, and facial swelling. The disease is spread through contact with exudate from infected chicken. Chronically ill or health carrier chicken are the reservoirs for the Avibacterium paragranum that causes infectious coryza. All chicken of all ages are susceptible to the infection, but this infection is mostly visible in elderly or adult chicken. The incubation period is 1 to 3 days, but full-blown signs are seen in 2 to 3 weeks. Transmission of the disease is through direct contact, airborne droplets, or drinking contaminated water. The following are the signs and symptoms of infectious coryza in poultry. Number 1, there is pus-like exudate from the nostril and eyes. Number 2, breathing difficulties. Number 3, there is loss of appetite. The poultry lack the feeding habits of the poultry decreases. There is a decrease in weight and egg production. Number 4, the comb becomes pale and swollen. Number 5, the lower respiratory tract is affected, and hence there is production of a sound that is rackled, like the rattling of pepper, the sound that the poultry produces. There is that sound of rattling of the pepper. It sounds like a rackle of pepper. And then there is difficulty of walking or lethargy. Now we come to the critical part of treatment of the coryza infection. Now you bring, first of all, as a veterinarian or as a farmer who has got the necessary information on how to handle the case, you prepare yourself. Put on protective gears. By protective gears, I mean you put on gloves, and then you put on a dust coat. And also prepare your workbench. Bring in your methylated spirit, bring in your surgical tools, and then be ready and set. Ensure that your workspace is very clean and tidy. Now bring in your chicken and restrain it properly and put it right at the middle of the workstation or your workbench. Ensure that you have someone who's going to assist you on restraining the chicken properly. Now, after restraining properly, take your hand on the swollen part around the eye, and then apply pressure. Press slowly, but apply a good amount of pressure until the swollen part ruptures and a clear white substance comes out. Then when it has come out, take your pair of forceps and hold it. Then you remove it slowly. And remember, our main aim of doing this procedure is to help save the eye of the poultry or of the chicken. So you pull it slowly so that you can avoid harming or injuring the eye. And after it has come out, the whole of it, take your methylated spirit and a pair of and a wool, cotton wool that has got a methylated spirit, and then disinfect the area properly. Then now you can use the erythromycin or any other antibiotic, that is the oxytetracycline, specifically oxytetracycline. You give the poultry in 5 days. After 5 days, then you'll see a result. Also, you can give the sulfonamides and all the oxytetracycline or erythromycin in water, but ensure that every day you change the water. in the morning you clean the watering point very well. Then you put the drug into the water, you mix properly, and then you set it at a strategic place where the poultry can drink well for 5 days. After that, you'll see your poultry will recover well and everything will be okay. My dear audience, thank you very much for watching our video. I really look forward to hearing from you. In case you want clarification, there's information on how you can contact us. And also, kindly don't forget to subscribe to my YouTube channel and help us grow together and make a success out of our farming business. Thank you very much.